welcome you all to today's session. Today, in this session, we are going to discuss about a topic which basically is a very common sign and symptoms which will be often seen among the patient in a clinical setup. So today, we are going to discuss regarding a sign of pain. So what is basically pain is? So as we know, basically it is a subjective phenomenon which often will be complained by almost all the patients who are coming into a clinical setup for or in seeking of medical treatment for certain underlying disease. Now, what is pain is? Basically, it is considered now as the fifth vital signs of human being. So in 2003, American Pain Society have announced that the pain should be considered as the fifth vital signs for every individual. Now, the assessment of the pain should be as automatic as assessing a blood pressure and pulse for a individual client or for an individual patient. Now, as we know, the vital signs, it basically suggests the temperature, pulse, respiration, and your blood pressure. Now, it is having a very major important role to find out the basic suffering or basic sign and symptoms which is indicating any alteration for the patient body. That is the reason these four vital signs should be checked at a very regular interval, as we know, in basically in a clinical setting. Here we are seeing the American Pain Society have announced the pain as the fifth vital signs. So I guess you are understanding the importance of this particular sign, that is the reason why they are suggesting that this fifth vital signs or pain should be assessed at a very frequent and regular interval for every individual who are coming or who are presented to a clinical setup to seek medical care. So the definition of pain suggests whatever the person says it is existing whenever the experiencing person says it does. So I hope by this definition or by this sentence you are understanding the subjectivity of this particular vital signs of pain. So basically, we can say the pain almost always, or it is considered to be the most common sign which or because of which a person or most of the person will be asking or seeking a medical care. Now, pain basically is a protective mechanism, or basically it is considered as a warning sign which will be protecting an individual from a further injury. Now, this pain, you have to know or you have to note it down that it is a multi-dimensional experience, and as well as pain, if it is severe enough, even can hamper a person's life, even their activity of daily living. Pain often will be associated with the decrease of the quality of life for the individual. That is the reason often the people will be seeking a urgent medical treatment and a nursing care to minimize the pain in order to bring back the quality of life for them. So according to International Association for the Study of Pain, basically the pain has defined as a unpleasant and sensory experience which is often associated with a actual or a potential disease, damage, or which is described in terms of such a damage. So basically what happens here, we are going to see the International Association for Study of Pain have described the pain as a sensory and or unpleasant sensory and emotional experience. So that is the reason why we are going to call this particular vital signs or fifth vital signs of pain as a multi-dimensional experience for the client. Now, basically, the get control theory in the year 1965 suggests the type of pain or how the pain is basically formed for an individual person. Now, it suggests that the stimulation of skin evokes the nervous impulses. So here we are going to see basically some nerve endings will be almost always present in the peripheral area of a particular individual's body. Now, if this is getting stimulated because of certain stimuli or external or internal stimuli, we are going to see the person is more likely to suffer from pain. Even this gate control theory has also suggested that the stimulation of the large diameter nerve fibers basically inhibits the transmission of pain. Now, thus, it will be closing the gate. So, here we are going to learn how the nerve endings or the small nerve endings which are present in the periphery is causing the pain transmission. And we have seen in gate control theory, it is suggested that if the long durated or long diametered nerve fibers are stimulated enough, it actually can decrease the pain stimulation. Now, as we have learned that pain is completely a subjective experience. So often in subjective experience, a client will be describing you or a medical professionals regarding the pain, about their pattern of pain and the intensity of it. So pain and assessment and its treatment thus must incorporate multiple dimensions, or we can say if we are treating pain with only one dimension, it is very difficult to cure or to reduce the experience of the pain for the individual client. That is the reason multiple dimensional approach should be used in order to manage this pattern or this condition of pain for an individual client. Now, we are going to learn here what are the different dimensional approaches here we should focus on while we are going to treat or while we are going to deal with a person who is suffering from acute or chronic or maybe mild to severe pain. So, biopsychological model of pain basically includes the different dimensional approach. These are physiological dimension where definitely a person will be suffering from pain and they will be having a particular localized area where the pain will be present. Now, this is also subjective by the client. Next, we are going to see the pain, or if a person is suffering from pain, they will be having effect even their affect and cognitive level. That is the reason when we are going to treat a client with pain, we should focus on their affective and cognitive behavior or cognitive approach also. Even we have to assess and manage the behavioral and socio-cultural dimensions of the client as well. So in all these dimensions, we are going to manage the pain of a client, because you have to remember pain is not only a one dimensional experience for the client. So as we have learned the basic concept regarding pain, now we are going to learn about the mechanism of pain. So we have seen that it is a subjective experience, but definitely there are certain chemical or physiological changes occurring because of which a person is complaining or suffering from pain. So here we're going to learn about the basic concept of pain mechanism. So before going to discuss it in detail, you have to note down two most important topic, or we can say terminologies related to the pain mechanism. That is nociceptors and nociception. So we are going to learn here first about the nociceptors. What are the nociceptors are? Now, nociceptors are also termed as pain receptors. So you have to make it clear that this is the one of the most particular area where the pain mechanism or the transmission and processing of the pain for an individual person gets started. So pain receptors, which are also termed as nociceptors. Now, what are those? Now, these are basically the free small nerve endings that are present into the peripheral skin that basically responds only to the potential or actual damaging stimuli. Now, this intense potential damaging stimuli can include the presence of mechanical stimuli, thermal, even chemical stimuli. So if these stimuli are present for a particular individual, now these nociceptors or pain receptors basically start getting activated and the transmission of the pain starts for an individual's body. Now, not only the peripheral skin, but we are going to see the joints, the skeletal muscles, even the tendons also will be consisting of the nociceptors or pain receptors for them. For a particular individual's body, even on the cornea and fascia will be consisting of this nociceptors. So I hope you are understanding. These are the basic part from where the activation of the pain stimulation get initiated once there is presence of intense potential or actual damaging stimuli, which includes mechanical, thermal, or maybe chemical stimuli. Now, next we're going to learn about the process which is termed as nociception. So, nociception basically is the process through which the information of the tissue damage will be communicated to the central nervous system, where basically the actual processing of the pain starts and then a person actually can sense the presence of pain for them. So here we are going to see the nociceptors are the receptors or pain receptors which is accepting the stimuli. Then the process is named as nociception, where we are seeing that in this process we are going to see that the informations from the tissue damage will be communicating towards the central nervous system. So this pain mechanism basically involves four processes. So the four processes are, first one is known as transduction. The next step of this process or of pain mechanism is named as transmission. The third step of it is perception, and the fourth or the last step of the pain mechanism is modulation. So we are going to see the four stages. The first one is transduction, the second one is transmission, the third one is perception, and the fourth one is modulation. So we are going to learn here thus each and every step of pain mechanism one by one. So let us start here about the discussion of transduction. Now, what does this stage do, or how the body works in this stage? So basically, this involves the conversion of noxious stimuli, which includes certain mechanical stimuli, thermal stimuli, or chemical stimuli. Now, this noxious stimuli, once it is converting into an electric signal in our body, which is basically generating the action potential inside it, is known as transduction. So I hope you are clear now. In this stage of pain mechanism, we are going to see the noxious stimuli will be converting its energy into the electrical signals, which will be actually helping to generate the action potentials in our body. Now, this noxious stimuli actually can release numerous of chemicals in the body. Now, it can include hydrogen ion, substance P, even adenosine triphosphate. So likewise, all these chemical materials which are produced because of the effectivity of the noxious stimuli in our body will be ultimately helping or will be ultimately generating the action potentials. Now, how these action potentials are generating here, basically we are going to see that this particular noxious stimuli are going to activate the nociceptors which we have just learned. So this nociceptors, once it is getting activated, we are going to see this is going to generate the action potentials or electrical impulses in the body. So once the action potential have generated inside the body because of the activation of the nociceptors, now we are going to see the transmission or the second step of the pain mechanism starts. Now, what does this transmission do? Basically, as the name itself is suggesting, here we are going to see the action potentials will be traveling along by different pathways into the central nervous system. So here the action potentials will be continuing from the site of injury over the body into the spinal cord first. From the spinal cord, we're going to see that this pain stimulation or the pain sensation will be reaching to the brainstem or thalamus. So I hope you are understanding. The electrical impulses or the action potentials are first generating from the nociceptors at the injured site. So basically from the site of injury, first it is transmitted to the spinal cord. In the next step, we are going to see the spinal cord. From the spinal cord, these action potentials are going to travel into the brainstem and thalamus, that is the part of the central nervous system or our brain. Next, we are going to see from the thalamus, it will be going to the cortex area for further processing. So that is how the transmission or the second stage of the pain mechanism will work and will help to transmit the action potential from the site of injury to the central nervous system. Now, as we have learned from the spinal cord, it will be transmitted or the action potential will be transmitted to the brainstem and thalamus. There, the processing will be started. Now, depending on the processing, the person will be actually behaving towards the pain. So the next step after the transmission is perception. So as the terminology is suggesting here, perception. Now in this stage, basically a person will be perceiving the presence of pain. So when actually it suggests that this stage of perception occurs when the pain is recognized, defined and assigned via the individual's experiences towards it. So in this stage, actually the person will start complaining regarding the presence of pain or regarding the presence of an unpleasant experience. Now, definitely perception is a conscious experience of a client. So the person should be have a sound mind and a conscious state to understand the presence of pain for their body. Now, next we're going to learn about the modulation. Modulation in the fourth stage for the pain mechanism. Here we're going to see modulation involves the activation of descending pathways. Now, this descending pathway or activation of it basically exert the inhibitory and facilitatory effects. So depending on the degree and type of modulation, we are going to see the nociceptive stimuli may or may not perceived as pain. So definitely depending on this modulation only, a person will be complaining about their severity and also the type of pain. So next, as we have learned now regarding the pain mechanism, I hope you are clear about the four basic steps here, that is the transduction, the transmission, perception and modulation. We have seen how a person is basically exposed or getting exposure to external stimuli or noxious stimuli, which is ultimately activating the nociceptors and it is transmitting the action potentials from the injured site first into the spinal cord, then into the central nervous system, or we can say brainstem and thalamus. Even after that, it is going for the further processing into the cortex. We have seen in perception, basically through the descending pathways, a person is understanding the presence of unpleasant sensory stimuli for them. Next, we are seeing there is presence of modulation, which is basically deciding that in which extent a person is having a pain present. Now, as we have learned till here, next we are going to learn regarding the different types of pain. So first is we're going to learn about the nociceptive pain. The second type of pain named as neuropathic pain. The different types of pain depending on the severity basically classified into two more group of pain, which is named as acute pain and chronic pain. Now, basically, the acute pain and chronic pain will be depend on the duration of the pain sensation that is present for the particular individual. So, first we're going to learn here regarding the nociceptive pain. So, as we have learned, the nociceptors will be present all over our body, even to the deep tissues, even to the superficial tissues. Now, that is the reason the nociceptive pain is basically occurs when there is damage to the somatic and visceral areas of the body. Now, somatic and visceral areas, if there is any injury or any damage present over the tissues or tissue areas, we are going to see a person will be suffering from a nociceptive pain. Now, first we're going to learn what are the types of somatic pain. Now, here in somatic pain, basically we are going to classify this pain into two, that is the superficial pain and deep pain. So in somatic pain, the superficial pain basically will be activated or will be experienced by a client if there is any damage or injury is present over the skin, mucous membrane and subcutaneous tissues over the body. Now, this superficial pain often will be termed as a very sharp, might be a burning sensation or a very pricky pain. Now, this three burning pain, pricky sensation, and sharp pain is basically the feature or characteristics of the superficial somatic pain for an individual. Now, when we are going to learn about the deep pain, here we are going to learn that the deep pain will be basically suggesting a aching pain which is basically originating from a bone, a joint, muscle, skin, even the connective tissues. So you need to understand whenever there is presence of certain noxious external stimuli which is activating the nociceptors in the bone, maybe in the joint, skeletal muscles, or skin and connective tissues, we are going to see that the person will be complaining about the deep pain. Now, the next one is visceral pain. So, visceral pain basically suggests the activation of the nociceptors into the internal organs for a particular individual's body. Now, the activation of the nociceptors actually can occur in the internal organs, even in lining of the cavities of the body. Now, in response to this, there will be presence of definitely pathological conditions or changes. Now, this pathological conditions or changes often include the presence of ischemia, inflammation, even the stretching of the internal organs and their connective tissue layers. So often a client with a surgical incision or maybe certain disease condition like pancreatitis, inflammatory bowel disease, or maybe any inflammation related to any organs in the internal area of the body will be causing the development of visceral pain for a particular individual. So I hope till here you are completely aware about the nociceptive pain. Now we are going to see the next types of pain, which are also known as neuropathic pain. So here in neuropathic pain, we are going to see that there will be damage in the peripheral nerves, even in the structures of the central nervous system. We're going to see the person with neuropathic pain often will be complaining about hot flushing sensation. Even there will be presence of numbing. Burning, shooting, and stabbing is the major common feature which is seen for the neuropathic pain. Even sometimes a person with neuropathic pain can complain a very sharp and electrical shock like sensation into the injured part. Now, neuropathic pain can be sudden, intense in onset, even it can be short-lived. So I hope you are completely understood the concept of neuropathic pain now. So the examples of neuropathic pain may include the disease condition like post-therapeutic neuralgia. Even there can be presence of phantom limb. If the person is suffering from diabetes neuropathy, that is also often will be developing the condition of neuropathic pain for an individual. Trigeminal neuralgia is a disease condition which will be often associated with the development of the pain or neuropathic pain for an individual. So these are the examples of the disease conditions or the pathological alteration which is occur for a particular individual and causing the neuropathic pain development. So I hope you are understood the neuropathic pain now. Next, we're going to see one more type of pain which is also termed as central pain. Now, the central pain will be basically occurring because of there will be presence of lesion into the central nervous system or maybe dysfunction of the central nervous system. So now we are going to learn regarding the type of pain which is basically classified depending on the duration of the pain for a particular individual. Now, as I have mentioned that it is basically classified into two different segments. One is termed as acute pain and the second is termed as chronic pain. So first here we're going to learn about the acute pain. So for acute pain, always the onset of the pain will be very sudden and we're going to see the duration will be often less than 3 months. Now, often the acute pain can also depends on the disease condition because of which it is developed. So, as the time takes for the healing of that particular disease condition or pathological changes for the body, according to that, the pain sensation will be getting relieved for a particular individual. Often, we're going to see acute pain will be last longer or less than 3 months, or we can say if the client is reviving from the particular disease condition or as the healing is occurring, depending on that, the acute pain will be getting subsided. Now, the severity often will be varying from mild to severe. And we are going to see the cause of pain. We can say there is identifiable precipitating factors. So acute pain often will be related with some or the other underlying pathological disease condition. Now, it can be associated with inflammation or a direct injury or a damage or a tearing or shearing of a continuity of the skin and any organ. So I hope you are understanding that this particular acute pain will be having a very acute identifiable precipitating factors. So typical manifestations related to the acute pain. So as the pain almost always will be developed associated with certain underlying disease process, we are going to see the acute pain often will manifest by a increased heart rate. A person with acute pain almost always will be having an increased respiration rate. They will be also having an increased blood pressure. The person may show the symptoms like diaphoresis, severe anxiety. There will be pallor over the skin. The person also will be having agitation. The person, if it is severe enough, even can go for confusion. Even there can be presence of urinary retention sometimes for the client with acute pain. So these are all the changes that will be occurring for a patient, and these are the symptoms which will be often present for a client who is suffering from acute pain. So the examples of acute pain often includes the pain which is suffered by a patient in a post-surgical phase. Even labor pain is considered as acute pain. We're going to see if the person is suffering from certain infections and inflammation for their body. We're going to see the presence of acute pain. Trauma, injury, and acute ischemia often will be associated with the development of acute pain. Now, if the acute pain is not treated well or not treated initially with needed analgesics and proper management, we are going to see the acute pain actually can extend and it can convert itself into a chronic pain. That is the reason if a client is present with acute pain, it is very important to manage at earliest and as easiest method possible so that the acute pain is prevented and the person is cured from it, and the prevention can be done for the further progression of the acute pain into the chronic pain. Next, we will learn about the chronic or consistent or persistent pain. Here, the onset will be often very gradual, or maybe it can even sudden. So majority of the cases we are going to see the chronic pain will be very gradually developing for a particular individual. Next, we are going to learn about the duration of chronic pain. So it definitely will be present more than 3 months. Now, if the pain sensation is present for more than 3 months, then only we are going to term the particular type of pain as chronic pain. Now, it will be almost always starts with an acute injury or as acute pain or event. Now, this will be continuing and it will be passing the normal time of recovery as well for the individual. Now, then only we are going to term this particular sensation as a chronic pain. The severity is definitely will be depending on the mild to moderate. So chronic pain can be even mild, even it can be very severe and moderate even. Now, causes of the chronic pain often involves certain underlying disease condition. But here, the important note is that original cause may differ from the exact mechanism that is maintaining the pain sensation for a particular individual. Now, course of pain, definitely we are going to see the pain will not be usually subsided with the proper management. Even we are going to see the periods of the pain will be having certain increase and the decrease in the pain sensation. Now, typical manifestations of chronic pain, it definitely will be including all the manifestations which we have learned in the acute pain. But majority of the client with chronic pain, we're going to see they will be showing the feature of physical inability. Even there will be presence of a severe fatigue for the client. Even behavioral pattern and social interaction can be interrupted because of the presence of chronic pain. We're going to see next the pain control should be done in extent possible. So basically, focused management would be done to enhance the function and the quality of life for a person who is suffering from chronic pain. Next, we are going to discuss regarding the factors which are often influencing the response towards the pain. So basically the factors will be including the presence of a negative past experience. So suppose, for example, if a client have suffered from a very severe pain even during the time of labor, right? So as the ultimate result of the labor pain is a positive thing that they are able to see their baby, so that person will not be having a very negative connection or negative thinking regarding the pain. So if next time they're suffering from any disease condition and that is causing the pain, the tolerance of the pain will be more for the particular client who have just sensed the pain during the time of labor. But if a client have suffered from a very severe traumatic injury and due to that he have already suffered from a chronic pain, now recently due to some disorder he have developed certain sensation of pain. Now they will be having a negative thinking or negative thought process associated with the pain sensation. There's a reason the tolerance here for that particular client is tend to be reduced. That is the reason we are going to see the past experience of the pain for a particular individual is definitely a factors which will be influencing of the individual's responsiveness towards the pain sensation. We're going to see the psychological state of the individual also will be almost always associated with the pain sensation and the perceivedness of it. The cultural status, the socio-cultural background, the gender, even genetics also plays a very important role, which will be basically, managing or which will be basically deciding a person's responsiveness towards the pain sensation. So till here, I hope you guys got a good idea regarding what is the basic concept of pain, how the mechanism of pain is activating inside the body, and how a person is perceiving the pain or sensing the pain, right? Now we are going to learn about a very important part, that is pain assessment. Now, pain assessment plays a very important role, as we have discussed earlier, that the acute pain, if it is present, should be managed at earliest to prevent the chances of the development of chronic pain. And a very prompt assessment and a proper management definitely helps our individual to tolerate the pain and to get reduced with the negative experience of pain. That is the reason, as a medical professionals, basically as a nurse, it is a very important role of us to assess the pain for each and every client who is present in clinical setup to seek medical care. So basically, the pain assessment first includes a detailed and thorough history collections. It first includes the present and past history of the client. Here, basically, we are going to ask client regarding any other disease condition that is the person is suffering from that in earlier. So also we are going to note down all the medications that are used by the client here, because this detail help a medical professional to understand the tolerance of the person if he or she is suffering from pain. Next, we're going to learn about the present and past surgical history. So we should ask the client regarding the presence of any surgical history, whether it is present or not. The collection of the data also helps to identify whether the person is having an underlying disease condition or a high risk for developing of underlying disease condition, which may or may not be related with the development of pain. Once we are collecting the data for past and present medical and surgical history, next we are going to ask the client regarding the family history. Now, family history would be showing whether there is presence of any chronic disorders is there in the family members or not, which is basically helps a medical professional to identify the high risk group and the probable causes which is associated with the development of a chronic pain. Next, we're going to ask the client regarding their lifestyle. Here, we are going to ask the client regarding their dietary intake, their daily activities, their habits, even the pattern of exercise, even their rest and sleep cycle, even about the intake and output. Basically, this data helps a medical professional to identify whether the person is, following a proper healthy lifestyle or not. So, a person who is having a history of alcohol consumption, for them maybe the analgesics dosage will be differ. So this all data basically helps a medical professional initially to identify the probable cause, the pattern of the pain, even the probable causes which is associated with the pain development, and the probable points of management which should be ensured by a medical professional towards the client. We are also going to assess here the coping and stress tolerance. So here the client should be asked about their perceiveness of the pain sensation, and here basically a open-ended question will be asked to client to share their experience regarding what they're experiencing or which type of pain they're experiencing, through which we are going to collect the data related to their coping strategies and their tolerance of stress and pain, which is also very helpful to minimize and to provide effective management, or to provide or plan effective coping strategies for the client to manage with the pain. Now, physical examination should be done here once the history collection is over. Physical examination includes the evaluation of functional limitations, abilities of the client, psychological, even the social evaluation. Now, often our clients will be going for a head-to-toe examination, even systemic examination. Here, our medical professionals, basically a nurse, will be trying to identify the probable alteration that is present, the related signs and symptoms like the presence of increased heart rate, increased breathing, which also will be indicating the severity of the pain, because you need to understand pain is completely a subjective experience. So this symptoms or evaluation of these symptoms while performing a physical examination definitely helps to identify the extent of pain which the person is suffering from. Also, evaluation also will be showing whether there is any presence of infection, inflammation over the skin or over the body, which is related with the presence of pain. Now, often the person will be assessed in their psychological manner. So here we are going to assess the psychological state of the client in order to understand their coping strategies and their tolerance level, which is also helpful in the management of pain for the client. Now, social interaction of the client should be assessed here to identify whether the client's social activity or the quality of life has been decreased due to the presence of pain. So as we have learned, the history collection and physical examination plays a very important role here. So the major initial steps for the pain assessment includes obtain a complete health and pain history. Now we are going to see here, we are going to do the pain assessment as well in a very thorough and detailed manner for each and every client. So we will be starting the pain assessment with asking the client or allowing the client to describe the pain. So basically here, medical professionals or a nurse first will be building the trust and connection with the client or the patient. So due to after that, our client will be definitely asked to describe their experience of the pain. So through which medical professionals should discover the effects of the pain which has been affected their quality of life definitely. So once it is noted, that definitely shows that the severity of the pain. Even we are going to learn here the emotional, spiritual distress as well as the coping abilities of the client for pain assessment. So elements of pain assessment, basically it include direct interview, even the observation while assessing the client. We are going to assess the pain pattern. So basically here we are going to assess the onset of pain, which involves the determining when the pain has been started, which is almost always will be suggesting whether a person is having a neuropathic pain or a nociceptive pain, or whether it is acute and chronic pain. Next, we're going to ask about the client, the duration of the pain. So here we are going to assess for how long the person is suffering from pain. So definitely this would be suggesting whether the person is suffering from acute and chronic pain. Next, we are going to try to assess the cause of pain, which will be often will be done through usage of diagnostic procedures as well as physical examination. Basically, you need to understand the underlying disease process. If it is cured, the person will not be suffering from pain anymore. There is a reason the causes should be identified here. The site of the pain also should be localized by the patient and the observation should be done for it, because the site of the pain present would be basically suggesting which underlying disease condition or which are the system may involved in the development of the pain sensation for the client. As I said, the site also sometimes will be suggesting the referred pain or presence of referred pain. Now we are going to learn what is meant by referred pain. So referred pain basically suggests it must be considered when interpreting of the location is done by a client or a client is complaining the pain sensation over a particular location, but that particular location or pain over that particular location almost always will be associated with an injury or a disease process into the visceral organ. So that is when we are going to call this type of pain as referred pain. For example, the angina pectoris can radiate from the chest even to the jaw and down to the left arm. Some patient will be literally complaining that the pain is present over the left arm or maybe to the shoulder and to the jaw area. So it is our responsibility to identify the presence of referred pain. That is the reason a medical professional and a nurse should be very well aware regarding the presence of type of referred pain. So if a client is suffering from the pain in different locations, definitely marking of the painful site should be done, and areas on a pain map should be developed to identify the basic areas where the person is complaining regarding the presence of pain. So intensity also we are gonna learn here that what extent the person is suffering from the intensity or suffering from the pain, right? And also the quality of the pain we are going to ask. So whether a person is suffering from a throbbing pain, whether a person is suffering from a burning or pricky pain. Now this quality of pain often will be helping a medical professionals to understand which type of pain it is, whether it is a nociceptive pain or whether it is a neuropathic pain. Now, the associative symptoms, as I have said, also will be documented. So, often the person will be present with anxiety, fatigue, depression as well. Even they will be suffering from many other psychological problems. So, that has to be noted here for the pain assessment. Often we are going to see the client will be having impact of pain on their sleeping pattern. Social interaction definitely will be impacted because of the presence, mainly because of the presence of chronic pain. Performance of the work, physical, social, and psychological activities and functions also will be altered if the person is suffering from a chronic pain. So, this all part or areas has to be noted down or observed for a client who is present with the complaint of pain. Last but not least, definitely the client will be assessed or observed for their attitude and also the expectations. Now, influence of the response to pain and its treatment definitely is there. So the person's attitude and their expectations also will be influencing the effectivity of the treatment. That is the reason here medical professionals and a nurse should definitely assess their perception and their attitude towards the pain sensation. Now, we're going to learn about a method by which basically the intensity of the pain will be assessed. Now, pain scale are the instruments which basically used to assess the intensity of the pain. Now, these are the numerical scale. So, by using the numerical scale, we are going to assess the intensity or the level of pain that is present for the individual. So, pain scale or assessing the pain scale is a very important approach to determine the analgesic which would be prescribed for the client examination, even systemic examination. Here, medical professionals, basically a nurse, will be trying to identify the probable alteration that is present. The related signs and symptoms like the presence of increased heart rate, increased breathing, which also will be indicating the severity of the pain, because you need to understand pain is completely a subjective experience. So this symptoms or evaluation of these symptoms while performing a physical examination definitely helps to identify the extent of pain which the person is suffering from. Also, evaluation also will be showing whether there is any presence of infection, inflammation over the skin or over the body, which is related with the presence of pain. Now, often the person will be assessed in their psychological manner. So here we are going to assess the psychological state of the client in order to understand their coping strategies and their stress tolerance level, which is also helpful in the management of pain for the client. Now, social interaction of the client should be assessed here to identify whether the client's social activity or the quality of life has been decreased due to the presence of pain. So, as we have learned, the history collection and physical examination plays a very important role here. So, the major initial steps for the pain assessment includes obtain a complete health and pain history. Now, we are going to see here, we are going to do the pain assessment as well in a very thorough and detailed manner for each and every client. So, we will be starting the pain assessment with asking the client or allowing the client to describe the pain. So basically here, medical professionals or a nurse first will be building the trust and connection with the client or the patient. So Due to after that, our client will be definitely asked to describe their experience of the pain, so through which medical professionals should discover the effects of the pain which has been affected their quality of life definitely. So once it is noted, that definitely shows that the severity of the pain. Even we are going to learn here the emotional, spiritual distress as well as the coping abilities of the client for pain assessment. So elements of pain assessment basically it include direct interview, even the observation while assessing the client. We are going to assess the pain pattern. So basically here we are going to assess the onset of pain, which involves the determining when the pain has been started, which is almost always will be suggesting whether a person is having a neuropathic pain or a nociceptive pain, or whether it is acute and chronic pain. Next, we're going to ask about the client, the duration of the pain. So here we are going to assess for how long the person is suffering from pain. So definitely this would be suggesting whether the person is suffering from acute and chronic pain. Next, we are going to try to assess the cause of pain, which will be done through usage of diagnostic procedures as well as physical examination. Basically, you need to understand the underlying disease process. If it is cured, the person will not be suffering from pain anymore. There is a reason the causes should be identified here. The site of the pain also should be localized by the patient, and the observation should be done for it, because the site of the pain present would be basically suggesting which underlying disease condition or which are the system may involved in the development of the pain sensation for the client. As I said, the site also sometimes will be suggesting the referred pain or presence of referred pain. Now we are going to learn what is meant by referred pain. So referred pain basically suggests it must be considered when interpreting of the location is done by a client, or a client is complaining the pain sensation over a particular location, but that particular location or pain over that particular location almost always will be associated with an injury or a disease process into the visceral organ. So that is when we are going to call this type of pain as referred pain. For example, the angina pectoris can radiate from the chest even to the jaw and down to the left arm. Some patient will be literally complaining that the pain is present over the left arm or maybe to the shoulder and to the jaw area. So it is our responsibility to identify the presence of referred pain. That is the reason a medical professional and a nurse should be very well aware regarding the presence of type of referred pain. So if a client is suffering from the pain in different locations, definitely marking of the painful site should be done, and areas on a pain map should be developed to identify the basic areas where the person is complaining regarding the presence of pain. So intensity also we are gonna learn here that what extent the person is suffering from the intensity or suffering from the pain, right? And also the quality of the pain we are going to ask. So whether a person is suffering from a throbbing pain, whether a person is suffering from a burning or pricky pain. Now this quality of pain often will be helping a medical professionals to understand which type of pain it is, whether it is a nociceptive pain or whether it is a neuropathic pain. Now, the associative symptoms, as I have said, also will be documented. So, often the person will be present with anxiety, fatigue, depression as well. Even they will be suffering from many other psychological problems. So, that has to be noted here for the pain assessment. Often we are going to see the client will be having impact of pain on their sleeping pattern. Social interaction definitely will be impacted because of the presence, mainly because of the presence of chronic pain. Performance of the work, physical, social, and psychological activities and functions also will be altered if the person is suffering from a chronic pain. So this all part or areas has to be noted down or observed for a client who is present with the complaint of pain. Last but not least, definitely the client will be assessed or observed for their attitude and also the expectations. Now, influence of the response to pain and its treatment definitely is there. So the person's attitude and their expectations also will be influencing the effectivity of the treatment. That is the reason here our medical professionals and others should definitely assess their perception and their attitude towards the pain sensation. Now, we're going to learn about a method by which basically the intensity of the pain will be assessed. Now, pain scale are the instruments which basically used to assess the intensity of the pain. Now, these are the numerical scale. So, by using the numerical scale, we are going to assess the intensity or the level of pain that is present for the individual. So basically the use of WhatsApp and PQRST and old card, these are all the mnemonics that are used for the pain assessment. We're going to learn here that how it will be used for a client and for in a clinical setup. So first we're going to learn about the mnemonic of WhatsApp. So basically the W stands for where is the pain. It is basically suggesting the localized area of the pain or to locate the area of the pain. Now here, a client will be asked to be specific. Even a medical professional who is recording the pain, they should be very specific enough to address the location of the pain. Now, to communicate in a better way, sometimes we will be using the image of the body to point out the exact location of the pain. Now, next is H. Basically, here H stands for how does the pain feel? Now, basically, it is suggesting to or it is asking the client to describe the type or quality of pain. So, if you ask how does the pain feel to you, definitely a client will be telling you that the pain is a shooting sensation or it is providing me a shooting sensation, or maybe there is presence of burning sensation. So that is the basic method how we are going to ask the quality of pain. So next we are going to see about the word of A. Here A stands for the aggravating and the alleviating factors related to pain. A client will be asked here that what are the factors or what are the activity you are doing on which the pain intensity of yours is increasing. Now, for example, if a person is coming to or presenting to a clinical setup with angina, we are often going to see the client will be complaining that if I'm doing a proper activity or any activity of daily living, I am having an increased pain sensation. So basically, this aggravating factors has to be noted in this state. Elevating factors also should be noted here. Basically, a client often with angina pectoris, for example, will be telling if I am in rest, then also the chest pain is not going. But if they're not having a severe angina, we are going to see the client will be telling if I am on a resting phase, the pain is subsiding. So that basically is suggesting which are the activity by which the pain will be able to manage. So this elevating factor also should be noted down because these are the data which will be very helpful to identify which pattern of pain and which are the probable causes related to pain is present for individual. Now, next we are going to learn about the T. So basically here T stands for the timing. So basically initially we will be asking the client to note down where or when which time the pain has been started, right? And also we are going to ask whether it is an intermittent pain, whether it is a continuous pain, whether there is any decrease or increase in the pain intensity. Now here we are going to see whether the client is complaining about a continuous or intermittent pain and when the pain actually has stimulated or getting activated for the individual's body. So next is S. S stands for the severity. So how bad the pain is. Here we're going to use the pain scale again. We will be asking the client generally to rate the pain scale from 0 to 10. So if it is severe enough, often the person will be complaining or rating the scale as 9 or 8. If it is not severe enough, the person can actually rate the pain scale as 2 or 3. So through which we are going to understand the severity of the pain for the particular client. So next is U. Basically, U stands for useful data. Now, once we are done with the exact data of the pain for a client, next we're gonna ask the client related any associated symptoms, whether it is present along with the pain or not. For example, whether the person is suffering from any nausea, any vomiting, or any itching or fatigue, etc. Now, this associated symptoms often is very helpful to identify the exact causes of the development of pain for a particular individual. Suppose a person is having an inflammation, definitely they will be saying that I am having a swelling over the particular extremities. Now, this is basically will be suggesting that the client might have a disorder or inability there, which is associated with the development of pain. Now, suppose there is any breakage in the bone, so definitely a client will be telling that I am functionally unable. So that would be suggested to do a physical examination and diagnostic procedure, which will be definitely conclude the underlying pathological condition which is associated with the development of pain, through which we are going to learn regarding the associated disorders even which is developing the pain. This format is very helpful to assess the pain and the disease condition or the probable disease condition to provide a proper management to the client. Next, the P basically stands here for perception. So last but not the least, you will be definitely asking the client regarding their perception for this experience of the pain. So as we have learned regarding the format of WhatsApp, now we are going to learn about the format of PQRST. So similarly here, P stands for provoked, or what are the provoking factors associated with the pain. Next we're gonna, Q basically stands here the quality of pain, which will be showing whether the person is having throbbing pain or pricking pain. Next is R, that is basically identifying the region or the localized area where the person is suffering from the pain or where the pain is present for the person. Next is definitely S, which is suggesting the severity of the pain. T often will be standing for the timing of the pain. Through PQRST also, similarly like WhatsApp, we are going to collect the important data related to the pain. Now, old card basically stands for, O stands for the onset of the pain. L stands for the localized area or the location of the pain. D stands for the duration of the pain. Whereas the C stands for the characteristics or the quality. A stands for the aggravating and elevating factors. R stands for whether the pain is radiating or not, to identify it. And T basically suggests the probable treatment, what is perfect for the client to manage the pain. That is how we are going to see by different assessment, we are going to ask a detailed data, or we are going to collect a details data related to the pain from the individual. So even sometimes, as we have mentioned, the pain is basically a subjective experience. So daily pain diary should be maintained by a patient if it is required. Often for clients who experience a chronic pain, basically, this daily diary maintenance for pain sensation is a very helpful and effective method. Now, this definitely helps a nurse to identify the pain patterns, even the factors that are related with the pain. So, a client will be asked to maintain a diary each and every day whenever they have sensed the pain. What are the factors related to it or associated with it? what are the methods they have been used to decrease the pain, whether they had to use any other therapies or medications or any non-drug treatment therapies to reduce the pain or not, what is the intensity, whether if they're using of medications, whether the intensity of the severity of the pain is reducing or not, that all has to be noted by a client. Now this basically shows if a client is present with a chronic pain, whether a drug therapy or a treatment therapies which has been planned before is effective or is properly acting for a particular individual or not. So depending on the responsiveness of the client towards the planned treatment, we are going to plan further for the different treatment modalities to manage the chronic pain for the client. So basically, the daily diary of pain recording will include the time and onset of the pain along with the date. Activity before the pain. So just before the onset of the pain, which activity the person has been, done. So if a person is suffering from any gastrointestinal related disorders and they're having a pain sensation, probably once a person is having food, soon after that, the person will be complaining with the pain. So that has to be noted down, that which activity he or she might have performed just before the onset of pain. Next, we are going to see the client will be also asked to note down the pain related positions and behaviors. Pain intensity often will be noted by the client every day. Use of analgesics, whether they're using every day or not, which are the treatment procedures they are following, that has to be noted by the client. Even the relief measures that are used, which are not medical or non-drug measures, also should be noted by the client in our diary. Next, we're going to see the duration of the pain should be noted here. The time of or the time spent in the relieving activities for the pain also should be noted. Basically, which will be often understandable or which will be basically suggesting whether the client is having a decreased or having a high risk for the decreased quality of life. Now, visual analog scales often will be used to identify the severity of the pain. Here, the client will be asked to place a mark indicating where the current pain lies. Now, basically, here, as you are seeing the pain scale over here, we are going to assess the client's pain severity with the visual analog scale. So basically, the left side of the pain scale shows there is no pain or very mild pain, whereas the right side of the pain scale shows that it is the severe and worse pain that is suffered by a client. Phase pain scale often will be used in a clinical setup to identify the severity of the pain which is present for a particular individual. So guidelines for the using the pain scale assessment. So the scale should be definitely used consistently. So nurse definitely have their role and responsibilities to teach the client, even to the caregiver in case of chronic pain, to use the pain scale in an effective way before the onset of the pain. So next we are going to see the another guideline says written pain scale may not be used for client who are having very serious illness or a severe pain, as well as who have just returned from the surgery. So here numerical rating should be used and documented, which will be also used to assess the effectiveness of the therapeutic modalities to treat the pain for the client. Even the pain scale will also helps a person or medical professionals to identify the effectiveness of the particular interventions which has been planned and modify it further. Now, documentation plays here a very important role. So many healthcare facilities and agencies had adopted some specific tools to record. Even here, the initial pain assessment, the treatment, and reassessment would be recorded to identify whether the client is responsive towards the proper pain management or not. So even there will be usage of multidimensional pain scale, which includes the McGill pain questionnaire, mention pain assessment card, as well as neuropathic pain scale. Now, this all scales definitely helps to identify the pain in multidimensional approach. Reassessment also should be done for the client at a regular interval, basically depending on the pain severity, the physical and psychological conditions of the client, the types of interventions that has been suggested to the client to manage the pain, as well as the risk of adverse effect should be reassessed if there is a usage of prolonged analgesics. Institutional policies for reassessment also depends on the performing of reassessment for the client with pain. So I hope you understood the session. Thank you so much for attending the session. We'll meet you guys in the next one.